there's been a lot of thought about this and a lot of discussion. I think there is a possibility that kids are overdiagnosed through misdiagnosis. There are many ways to diagnose ADHD. A thorough school and family history is one of them, including behaviors. Another one is psychoeducational evaluation, work samples, observation. We want to do what I call a multidimensional evaluation to get the best information. And unfortunately, a lot of kids, too many kids, I think, are diagnosed because they do a rating scale and it comes up positive, and the teacher's upset with how they're acting in the classroom, and so they're diagnosed with ADHD. And I don't think that's fair either to, I just don't think that's fair to the child or the family. So, I think that perhaps misdiagnosis is one of the reasons that the rates are high. Secondly, I think that the change that happens over time. So about 2/3 of kids with ADHD continue to have ADHD as adults. But if you're an adult and you're having trouble at work or you're having trouble in your relationship, no one's going to actually take you to the doctor. No one's going to talk to your teacher and about what's going wrong. You as an adult have a choice about whether you want to do something about that and what you want to do about it. And so I think one of the reasons that the rates are lower for adults is they don't take themselves, or they don't even think about that they might need a diagnosis. And then, a lot of times they've just adjusted. It's like, oh, that's just me. I'm eccentric, or I'm quirky, and I figured out how to live with it, or I'm just messy and I'm late to things, and I have trouble focusing, but I've adjusted. And so there's sort of a minimization of the symptoms. So I think that's part of what we're seeing. I also think that a lot of kids today are really struggling. They're struggling at home and at school with the onslaught of social media and technology, and they're anxious. There's a lot of anxiety in kids today, much more anxiety than we've seen ever before. And so anxiety can look like ADHD. PTSD and trauma can look like ADHD, and in fact, sometimes they go together. So so sometimes those kids are diagnosed with ADHD as well as a primary diagnosis, when it might actually be something else that just looks like ADHD right now. The fact is that one of the reasons I think that the numbers are higher is that we understand ADHD so much better now. And so we are more sophisticated in our analysis of what ADHD is than we were even 10 years ago. In order to be diagnosed with ADHD, you have to have 6 out of 9 symptoms in 2 areas of functioning for 6 months. Okay. And so there are 3 types of ADHD. There's attention deficit hyperactivity disorder with hyperactivity impulsivity. Then there's ADHD with inattention, which used to be known as ADD. And then there's ADHD combination, where you have both of those kinds of ADHD. And so, when properly diagnosed, it's fairly rigorous. It's a fairly rigorous process, not just you fill out a Conners or a Vanderbilt scale and all of a sudden you're diagnosed. Whoever's doing the diagnosis needs to take a thorough history, needs to talk to the school, will absolutely give some rating scales, as well as perhaps a psychoeducational evaluation if a child is struggling at school and may have a coexisting learning disability. So we want to get a lot of information before diagnosis, and that helps parents feel more comfortable with the diagnosis, I think, ultimately. But because a parent and a child doesn't really get along, no, that would not, mean that you have ADHD. For my book, I interviewed dozens of kids with ADHD and also their parents. And what the kids told me is that there lots of things about living with ADHD, but sort of was able to categorize it into 5 themes. So the first theme is that they want parents to manage themselves, to regulate themselves, and to practice more self-control, which is the first C, because it's very hard for kids with ADHD to manage themselves. And when parents are dysregulated, it makes it even harder for kids with ADHD to behave appropriately and make effective choices. So the first C is self-control. You, the parent, the adult, you manage yourself first, and then you help your child. And for anybody who's ever been on an airplane, it's like the oxygen mask on a plane. You put it on yourself first, you pull yourself together, and then you can help your child. If you yourself are agitated or angry or yelling, there's very little chance that your child is going to stay calm. So the first C is self-control. The second theme, what I heard from kids is that they want to feel understood and accepted for who they are and forgiven, even if they don't understand or accept themselves. And this is the second C, compassion. And what this means is that we're going to meet kids where they are, not where we expect them to be. And that's important, because a lot of times we kind of foist onto our kids unrealistic expectations about how they're supposed to be behaving. You have a 9-year-old who's you have a sister who has a 9-year-old who's neurotypical, and your son has ADHD and is 9. They're not at the same level in a number of ways. And so comparing your son in terms of his organization or his memory or his focus to, your nephew is not really fair to your son, and he'll never make that standard. He's got to be seen in his own light. And so that's really what compassion is. And compassion is also having compassion for yourself as a parent. You're not perfect. You're going to make mistakes. You're going to blow it sometimes. That's okay. It's normal. The third C is that kids told me that they want to have a say in programs that are created to help them. And this is the third C, which is collaboration, which means working together with kids to solve issues and help them come up with systems that make sense to them. Okay, and so what we do is we create incentives that matter with our kids, and we use these incentives to motivate them. And so we're working together on a plan rather than deciding what the plan should be. Because kids with ADHD and kids who are on the spectrum and kids with learning disabilities, these are what I call outside the box thinkers. And these kids have idiosyncratic ways of approaching situations, tasks, relationships, activities. And sometimes those approaches are ill-fated, and sometimes they're just different. They're fine, but it's like, you do it slightly differently. And so in that way, I think collaboration is essential. The fourth thing kids told me is they want adults to do what they say they're going to do most of the time. And this means consistency. That's the fourth C. And of course, consistency is not about perfection. You can't be perfect as a parent, but it's about doing something more often than not. It's about being kind to yourself when you forget. It's about making exceptions that are thoughtful, and you tell your child that it's an exception. And it's about noticing their efforting. And efforting is a term that I created that means how kids with ADHD try, and then try, maybe have a setback, try again. We want to help kids with ADHD continue that process of trying. And that really is about resilience. And so consistency builds resilience. And the fifth thing kids said is they want more positivity, more positive feedback. And the C is celebration. This doesn't mean you bake a cake for your daughter because she cleared the table. This is actually specific praise and positive feedback for actions, words, and behaviors that you see your child doing that are things that you're trying to nurture in them. And so the positivity ratio by Dr. Barbara Fredrickson has been found to be 3-to-1. I ask parents all the time when I speak with them, what do you think the positivity ratio is for your child? And they generally say 1 positive for 15 negatives per day. And in fact, when I was talking to kids, when I have the privilege of speaking to kids, I ask them, and it's even higher in their opinion, 1 to 20 or 30, because they're including the negative things they're saying to themselves. This is tragic, and this does not build healthy self-esteem, and it also does not build resilience. And we want to teach kids how to be, like successful, independent adults. And in order to do that, they have to have a conversation in their head that counteracts the negativity bias that we all have and the persistent negative self-talk that they engage in. And so in order to do that, we have to be noticing what's going right much more often than we do. I think a lot of times where compassion fades out is because frustration takes over. And instead of saying what my child's behavior is showing me is that they're not capable of doing this task on their own yet. So they need help. They need more supervision. I'll be the folder and you put the things in the hamper. Whatever it is. A lot of kids, particularly kids with ADHD who have messy rooms, they go into their room to clean it and it's overwhelming. They start on one thing and then they get distracted, or some of them don't even have a list. Like, how do I go about cleaning my room? And these are things that we have to understand. It's hard for your child. It's not because they're trying to defy you, it's because they're not ready yet to do this on their own. The executive functioning skills don't finish developing fully until the age of 25 in neurotypical brains. And in brains with ADHD or LD or ASD, that can be delayed as much as 3 years. So that's 28. I remember I was actually talking recently with my daughter, and we were talking about how I used to help her pack, both she and my son, even when they were, my daughter's now 21, my son's 25, but when they were 18, 19, up to 18 or 19, I'd sit in their room. They'd say, I want to take this. I'd fold it. I'd say, well, you might want some socks. And they'd say, oh yeah, socks. And they get their socks. Like that part wasn't there yet. I think it's a lot about how our expectations kind of, merge with our frustration. We expect them to be able to do this and then they can't, and we're mad at them because of that. Or we tell them something over and over and over again and they're still not doing it. Well, they're not doing it is a sign to you that whatever method you're using, whatever system you have, isn't working. And if it's not working for them because you're not getting the consistency that you want, then the thing is something has to change. My motto is do more of what works and less of what doesn't. And so if it's not working, that's the time to reevaluate. Well, one of the things that I think is important is when you get an ADHD diagnosis, that you have had sufficient information has been collected about your child's functioning, that you actually know what some of their executive functioning strengths are and some of their limitations are. In fact, in my book, I have a chart a form that people can fill out about their own executive functioning skills, which is really helpful. Let's see where you are, what some of your strengths and weaknesses are, and how those may be affecting your child, or how they may be similar to your child or different. If you're super timely, if you're a very timely person, and your child struggles with time management and is always running late, that's going to be really frustrating for you. And you're going to get angry. And so what you're going to have to do is figure out how to teach time management more effectively. And so there are 11 executive functioning skills, and I talk about improving pretty much all of them in my book, and on my website there's tons of information about this. But essentially, in order to, before you choose any executive functioning skill, you have to think about your mentality. And your mentality needs to be that people can only change one thing at a time. So you want to change, you want them to be on time, you want them to stop yelling at you, you want them to keep their room organized, and you want them to turn their homework in. Like, that's 4 things. You know, how many things can you change about yourself at once? 1. So that means pick the most important thing, and then have the team, you, the school, your child, meet, come up with some sort of tentative solution, and try it for a week, and then meet again to follow up. One of the things that's really important in building these executive functioning skills is that you as a parent are going to have to participate more. You are your child's executive functioning skills for longer than you would like. You help create the scaffolding and the tools that they need. Everybody has something they're good at. Everybody, something they love to do, and it might be just petting the dog some days. But people, even kids, have something that you love about them. They're your children. We have to lean into those strengths. We have to nourish those. So if your child really is doodles all the time in school, maybe your child would like to take an art class. You know, if your child is always humming, maybe your child wants to learn how to use GarageBand, make some music. You know, think about what actually you see your child doing that's engaging for them, and lean into that, expand that while you're working on changing a behavior. What kids with ADHD really need is they need help with the behaviors that they already can maintain. They usually need a little support in that. They need more support on things they can do sometimes. And then there's the ones that they're really reaching for. And that's usually one thing that you work on. So you have the things I can already do, the sometimes things, and the I hope. So what happens is if you spend too much time in the I hope category, then you're going to lose the progress that you're making in the most of the time and sometimes. So if you have a child who's struggling with self-control, what happens is most of the time in the middle of an eruption, you try to start negotiating things, you try to problem solve, and that actually is a path of perpetual frustration. Instead, what you want to do is notice what is the pattern that happens when your child is getting set off and when you yourself are getting set off. So for example, what are the bodily sensations that are giving you a sign or your child a sign that they're heading down into the pit, right? Of the dark fire pit of where everything builds and goes everywhere, right? So, or I like to say it's the volcano, right? There's things building inside of you and then they explode. And so how can you tell that something is building inside of you? Does your stomach hurt? Is your face hot? Does your heart start beating? Are you sweating? These are physiological signs that something is changing. We want to identify that as adults, and we want to help our kids do that too. So part of what we're going to do to help teach self-control is what I call premeditated planning. You can't plan for every possible scenario, of course, but what you can do is you can create a program for when things go off the tracks. You know, so I call this program Stop, Think, Act. So when you notice that things are going off the tracks, you have in advance, you have a conversation that when you notice that something's going off the tracks, you're going to call a stop. And that stop will look like a pause. And this is the hardest part. This is the hardest part. So you have to plan what's going to happen during that stop. So maybe your child goes to the room and listens to music for 10 minutes, because it takes around 10-15 minutes for the system to calm down once it's been fully activated. So your child is maybe your child wants to just listen to music on their phone. Maybe your child wants a hug and to hear a story, which is going to be hard for you if you yourself are activated. Maybe a drink of water, maybe going to shoot some hoops or riding the stationary bike. Or some people, I advise them, just go to the bathroom. Wash your hands. And if you're an adult, that's one of the things I like to do when I'm a little distressed. I excuse myself, I go to the bathroom, I wash my hands, I take a deep breath, I look at myself in the mirror and say, "You've got this," and go back out. Even if there's chaos on the other side of the door, I've actually pulled myself together. Some older kids can do this for themselves as well. So we want to come up with what is the pause. I worked with one family, this one mom, she had 3 kids, 2 of them had ADHD. And so we concocted that she would go to the dollar store and she made calm me down boxes. And everyone had a calm me down box and had things in it that they wanted to do. And when she called a stop at home, everybody did their calm me down boxes. So that's the stop part. After the 10 minutes or 15 minutes has gone by, you come back together and you talk, you think, you discuss what happened using reflective listening. You don't say, "Why did you do that?" You say, you use statements of observation. "It looked like you were very angry at your brother. What was making you so angry?" "He kept calling me names and you didn't hear it." "Oh, okay. So he was calling you names and I wasn't there." "Yes. And then he stepped on my Lego and then I bit him." "I see. So he stepped on your Lego and then you bit him because you were mad." "Yes. I don't want him stepping on my Lego and I don't want him calling me names." Okay. So we'll try to, let's talk about that at another time. Thanks for telling me. I'm really glad you shared that. And what do we want to do right now? That's the act. What is the next right thing you're going to do? You are not going to remedy the situation. That is not, you're not going to go bring in your son and talk to him about how what he did with your daughter was the wrong thing. You're trying to just keep a calm, introduce calm into the system. And then you say, well, what is the next thing that you'd like to do? And your daughter could say, "I want help cleaning up my Lego and I want him to help me." And you can say, "Okay, that's reasonable. I'll talk to you. Let me get your brother and we'll all help clean up the mess." So you're talking it through. So you see, I'm not solving the problem of why the brother did this in the first place. You can't do that in a moment when people are stressed. That's something that has to happen separately, right? And then you can say, "We'll discuss this in the next 24 hours after everybody's calm." Now, of course, you can't do that in the middle of a grocery store when, your child wants you to buy Cocoa Puff cereal and you don't want to buy Cocoa Puff cereal and they start screaming at you. In those moments, what you probably have to do is say, "We had an agreement that if you scream at me in the grocery store, we're leaving, so we're leaving." And you leave. Because if you don't follow through on what you say you're going to do, what happens is that your children don't believe you. Model what that looks like. And we want to teach follow through by modeling what that looks like. These all come together. When your child actually is able to regulate, afterwards, you say in a loving way, hand on the shoulder, "You know what? I really liked how you practiced stop, think, act. That was great. Give me a high five." You have to do this very, very, very slowly, but this goes back to self-control. Who's the first person that you have to worry about? Because if you're not regulated, you can't do anything of this. Yeah. And this is actually possible. It's possible to sit down at dinner, after dinner, and say, "We're going to have a short family meeting of no more than 15 minutes to talk about these explosions because I don't like arguing with you and you don't like me yelling at you. So what do you think is the thing that we argue about the most?" "Okay, I agree. That's one of the things. But since that's on your list, we're going to go with that. Let's come up with a plan." You include kids in a plan, you incentivize them. Every time that you follow through on stop, think, act, you can earn some privilege that you like. Maybe that's extra screen time even, or maybe that's a special thing with me. You know, we go out and we get a cup of tea and a treat. But you set up these things. You have to have some kinds of ideas of how to deal with the process, not the content, because the content will keep changing, meaning everything that people get upset about changes. It's the reaction that we're interested in. Well, I think that what happens is that children get a definition of who they are through these posts, through these sites where people are projecting aspects of themselves that they want other people to see, and not actually who they are in real time, in real life. And so kids are developing an inner sense of who I am based on, you know, what I would call this sort of fortified notion that they put up of themselves on these sites, or sometimes false notion, or sometimes wish I were like that kind of notion, right? I also think that social media allows kids to do or say anything without, you know, significant repercussions in terms of being able to see in real time the effect of your words or your actions on someone else. That's why, you know, bullying, online bullying is a huge problem. I think kids start to worry about what they're missing, because there's this idea in their, you know, still developing brains that that life is happening for all these people out there, over there. I'm not part of it. Well, how can I be part of it? I don't want to miss anything. I need to stay connected all the time. That's a lot of pressure for a growing child and for a teen. And so then they lose their ability to actually be in the present. You know, which is interesting because, ironically, you know, the ADHD brain is a now, not now brain. And so if whatever they're doing now is what matters, and what they're not doing now doesn't matter. But there's a way in which social media is so seductive that is the now, right? And so whatever's going to happen as a result of that later, like the fact that I didn't do my homework, or I was late for work, or, you know, I'm getting a detention because I was, you know, on my phone too much at school. These are things that really kind of affect kids' development and affect their ability to relate to other kids in a face-to-face basis. You know, I can't tell you, Magna, how many, you know, how many older teens and young adults I work with who have ADHD who don't like to make a phone call. You know, I'm working with one young woman, and she's applied for a job, and the woman liked her and said, go to this website and fill out the form. So she went to the website, and the website wasn't working. And she went again, and it wasn't working. So then she texted this woman and said, the website isn't working. The woman texted back, still not working. Her dad is a IT guy. He looked at it, wasn't working. So they come into my office and they said, well, I'm having trouble, you know, filling out this application because, you know, the site isn't working. So I asked her, did you call the woman? She said, oh no, I'm not calling. And so we talked about why she wouldn't call. And the sad thing was, because she didn't want to call, because she didn't think she was worth the woman's time. And that was fascinating for me. And so we made a little script, and she called the woman in my office, and then got the right site and filled it out, and texted me over the weekend that she got the job.
Oh, okay.
So just really interesting, all, you know, different ways of social media. The other thing is that kids today grow up with media multitasking, and that is not healthy for the brain, because essentially what you're doing is you're splitting your attention. And every time you shift from one thing to another, your brain needs a mental warm-up of several seconds. And because of that, with the pressure that we put on ourselves to shift constantly, our brains are stressed out. And then they run on cortisol, which is a stress reaction, which increases anxiety. So it's a whole kind of complicated mix of things.